that they are too are struggling with recovering from something, but so are we. And which brings me to point number 6, which is the population that we serve. Um, we must be understanding with our population. That they're coming to us for help. Um, you know, but we also need to make sure that we're keeping clear, precise boundaries for that reason, right? We need to keep boundaries in place, understanding that these aren't our family members. We want to treat them, you know, with dignity and respect, and we want to make sure that they get everything they need. But we also want to make sure that we keep clear boundaries with the clients. Um, if the client is having a challenge and it's a social thing, if there's a social issue going on, if they have questions, about their current level of care, or if you have questions about their current level of care or what next level of care they're going into, please make sure that you always link up with their counselor, whoever that counselor is. Find out who their counselor is. Front desk always knows. If they're in detox, they have one counselor, and that's Miss Jacqueline. But always make sure you link up with the social worker or the counselor that's on that case, so that the client will be serviced well, that they don't have a lot of different answers coming their way, because of the population we serve. Sometimes they are looking for, and more often than not, they're looking for a breach in the communication between the staff members. And if they get one answer out of you and you're the nurse, and they've already gotten one answer out of the counselor, and then they get another answer out of the case aide, and they get another answer out of the front desk, they're going to figure out, that these guys don't communicate with each other, and they're going to use that as a loophole, to either get what they want ultimately, or to do something that they shouldn't do. Get permissions. They're going to use that to try and get permissions, to leave, or leave services. We don't want to be the reason. If everybody has their own free will. This is a voluntary program, whether it's outpatient or inpatient, and so them leaving services is their right. But we want to do everything we can to keep them engaged in services, and we want to make sure that we stay in our lane so that we can provide the best care and service that we are capable of doing in our line of practice with that client at all times. And we want to make sure that we pass them on and link them to, we're blessed here at Outreach. We have, Miss Bernie, who is in mental health. We have, wonderful doctors that work for us, that work in, the medication management. So if it's a medication management problem and you're wondering something about their Suboxone or their Vivitrol or their regimen, always communicate that with the physician. I can't stress it enough that the lines of communication, even though we do well, we need to bring it up, because we need to be able to communicate so that the clients are getting everything that they need in order to reach the best possible level of sobriety that they can reach, that they can get to that, that potential in sobriety that they are looking for. Um, Making sure that we understand that this is their journey. They are the drivers, right? And we're the GPS. And so, as long as they have us on board, we want to make sure that they're getting where they desire to go, and they're getting there in the most healthy way and the safest way possible, without risk, or with as minimal risk as possible. And so, I'm saying that to say I'm grateful for outreach and what we provide for the clients, and so are they. But we want to continue to provide that, and making sure that the wires don't get crossed. Let's work together to service the clients and build up appreciation for each other's position, and and value what each of us bring to the table when it comes to outreach. And so, and I know that a lot of us have worked in various arenas. And so there are some things we just think we know, but if it's not a part of your licensure, please pass that on to the one that is licensed to practice medicine. If it's a physician, call, please make sure that those that are licensed to prescribe do so. If it's medical, or, I know that you may have had a sister, uncle, aunt, or somebody that had the exact same thing, felt the same way, had the same type of symptoms. And some of us are even caregivers in our own homes. But when it comes to the medical, please seek out a nurse's, a nurse's profession, their professional opinion. Seek that out. We have nurses, we have wonderful nurses that work for outreach. And so make sure that the clients are being linked with the proper professional when it comes to, what they need, whether that be medical, social, if they, we have great peer supporters. If they need support, if they need spiritual guidance and spiritual support, we even have a pastor. And so, saying, hey, I'm understanding you have some spiritual questions. We have a chaplain, Pastor Bays. Let me talk with front desk, and let's see if we can get you an appointment with Pastor Bays. Pastor Bays has always been great with going even over into detox, or even setting up appointments with those in outpatient in order to talk about their spiritual journey. And so let's just make sure that we stay connected, and that we make sure that the clients are connected with who they need for what they need. I also want to touch on this, that there are no romantic or social media relationships or interactions that should be going on between a staff member of any kind on any level and a client, someone that is a current client of outreach. We have a policies and procedures manual. I encourage you to read through that manual, even going through relationships and what our certification speaks to. There are different professions that may speak to different allowment times, as to the client needs to be, 2 months post services. Some say 2 years, some say 5 years. And I just encourage you to read our policies and procedures manual, and to make sure that you are not crossing the line or crossing boundaries that would ultimately put the client at risk. It is our duty and our responsibility to keep our clients as safe as we can, and to make sure that we're bringing them no harm. And I know that it would not be the intention of any of us to bring harm to any of the clients. And so please make sure that you read the policies and procedures manual. That is available at the front desk with Ms. Couture and Ms. Jasmine. Please see them. You can check that manual out. Make sure that you keep it on the premises. That does not leave the premises, but you can check that out on your lunch break if you want to read through it while you're eating your lunch. Please don't get anything on it. And also make sure that you have an employee handbook. If you don't have an updated version of the employee handbook, or you didn't receive one at hire, please make sure that you see HR department, Pastor Bays, or Couture front desk if Pastor is not available, to make sure that you do get a copy of that, and that you do read that. Anyone, I also want to say this in wrapping up and closing. That wasn't bad, was it? In closing, I want to make sure that all of those of you that are eligible for insurance, a packet, an application was filled out by myself in the HR team, and emails were sent out for you all to look over, fill out those applications, and get those back in I've looked and they said none to date have been filled out. So if you have gotten that email, if you could fill out that application and submit it back in if you want to be a part of the plan. If you have questions, please don't hesitate to give me a call and ask me questions in reference to what is available. We do pay 50% of the employee. The company pays 50% of the employee's premium, monthly premium. If you have family, you are able to add your family, but that would be at cost for you. But I do believe that the package that we have chosen is a fairly inexpensive package, but it's a good package through United Healthcare. And all of those preventative things are taken care of. Everything that's preventative, we've got dental and vision, medical, and I do believe there's even life insurance that is attached to that. And so, those of you that are listening that are part-time, but you have a desire to get insurance, let me know. Even though you would pay it at your cost, it's possible for you to tap into the insurance, and then that way you could be covered. You and your family will be covered. Again, that would not it wouldn't be a part of the benefit for those that are part-time. But if you don't have any insurance at all, it might be worth looking into just to see what the cost would be. And from what I understand, you can be a part of the of our policy. You would just pay your premium monthly, and that monthly premium would come out of your check. And we do split those up, that they come out every 2 weeks. But again, if you have any questions for those that are eligible, and those that will be coming up eligible, and those that are even part-time that may want to look into the insurance, please give me a call or let Pastor know, HR know, and we can sit down with you and give you the information. If you are not sure of your eligibility or your eligibility status or what would deem you eligible, please give Pastor Bays a call or see him when he's in the office. Set up an appointment with him to talk about insurance, okay? And he'll be more than glad to do that. We will be in Cincinnati quite a bit, and so we are at this point making sure that we have coverage in every area. We're getting to that place to where we're going higher. We also have a CARF accreditation that we're looking forward to, and that will I will kind of spell that a little bit more and explain that a little bit more in the next upcoming meeting. I also want to make sure that everyone that needs to get their TB and hepatitis and their physicals in, please make sure that those are done. I know that we're past the deadline, but we've been working with everyone because we know that this is something that just, showed up, but it is something that has to be done. And so if you've gotten your TBs done, wonderful. Please make sure that you turn those in to Miss Linda as soon as possible. She needs a copy of those so that she can mark you off as complete. As far as the Hep B is concerned, I know that we did get some Hep B in, and so those I will be working with our clinical director, our medical director, Chris, to see when we're going to actually, and Miss Linda, to see when we're going to do the Hep B. And I know that she has been working with everyone. Chris has been working with everyone to get the physicals done for those who don't have physicals by your physicians. If you have not gotten with Chris, please check with Katora and see how you would set up an appointment to get your physical done with Miss Chris, the clinical director of detox. Okay. So that's it. Looks like I was looking for a half an hour and we're at 28 minutes. And so I think that we did a good job. You will have a survey that will need to be filled out about how you think the virtual meeting went, and the information that was in the virtual meeting, what you thought about the information. Was it informative enough? Was it too vague? It's okay. We want to know how to grow this, because every month we'll be getting a virtual meeting, and then we will actually be meeting as a staff. All staff meetings will be every 6 months. So by semi-annually, because of the amount of people that we have, we're going to do a meeting semi-annually with everyone, from all the OCCs, whatever that means. So again, I'm signing off. It's your Chief Executive Officer, Michelle Bays. If you have any questions, again, don't hesitate to ask me or Pastor, or go to your supervisor and ask them, and they can give us a jingle if they can't answer your question. Until next time, everybody be blessed.